All right, so first, good evening to everyone. I want to thank all of you for participating in my action research presentation. The title of my presentation is Teen Vaping and Health Outcomes, Evaluating the Effectiveness of PSA Campaigns. So my action research is going to be conducted at Huffman High School. The enrollment for Huffman High School, Huffman serves grades 9 through 12. It's a Class 6A school with enrollment of 1,123. It's a four-year public school located in Birmingham, Alabama. The demographics of Huffman High School, we have 96% African American students, 2% Hispanic, 1% white, 1% multiracial, and Huffman High School is the largest Birmingham City school. Huffman competes in 6A level competition with a graduation rate of 90%. So for my action research, my problem statement, the problem that will be addressed in my action research conducted at Huffman High School is a primary health concern involving teens and vaping use and how teen vaping is continuing to trend. The study will use surveys to first gauge feedback from current students and their exposure to vaping, and then obtain input to assess the effectiveness of PSA vaping interventions. Even with intervention programs and health awareness, teens continue to vape due to social influences, availability of vaping devices, and believing that vapes cause less health risks than smoking traditional cigarettes. The research will explore why teens began vaping in the first place and continue despite health warnings. The students of Huffman High School will benefit from studying vaping trends as it can help them better understand the factors that lead to them making potentially dangerous decisions to use these products. So my hypothesis and research question that I will be looking at in this action research, the hypothesis is Huffman High School, 9th through 12th grade students in health class who are exposed to public service announcements that address the health risk of vaping and pressures to vape will reduce the number of vaping-related disciplinary referrals and decrease engagement of vaping behaviors than 9th through 12th grade students in health class with no PSA campaign. My research question is, to what degree will PSAs about vaping affect students' knowledge, attitudes, and perceptions of vaping? The next slide shows some terms that have been used throughout my research. The first term is invincibility beliefs. So invincibility beliefs refer to the perception among adolescents that they're immune to negative consequences. Nicotine addiction. This is having a dependency on nicotine, and nicotine is the highly addictive substance that's found in tobacco products. Peer normalization. So this is the process by which behaviors become accepted. Pod mod devices. These are the type of e-cigarettes that use pre-filled pods, often flavored and delivers high levels of nicotine compared to traditional base nicotine e-cigarettes. Vaping is the act of inhaling and exhaling the aerosol that's produced by the electronic cigarette. And then class 2 offense. So these are offenses that are considered disruptive, misconduct, defined as activities engaged in by students that are directed against persons or property and whose consequences tend to endanger the health or safety of oneself or others in a school. And this comes from Birmingham City Schools. The next slide shows my literature review. So as I was doing my research for the Action Research Project, there were 3 areas in particular that I focused on. So the first area that I focused on in my literature review was the use of public service announcements as we are addressing vaping. So public service announcements can have a significant influence on teen decision-making, particularly as we're looking at trying to discourage teens from starting to vape, or even if they have vaped. PSAs can help encourage the students to quit. Studies have also shown that media messages must be carefully crafted to achieve prevention goals for youth vaping. The next area that I focused on in my literature review was the impact that vaping has on academic performance. So student vaping trends continue to lead to discipline problems in schools, which can cause academic problems that would lead to a poor performance. Studies have shown that the rise in e-cigarette use has caused schools to divert staff time towards discipline enforcement, vape detention, and this takes away from the learning of students. And the last area that I focused on in my literature review was the health impact of vaping. So the rise in teen vaping continues to raise concerns about the health of teens, especially the impact that it has on the respiratory system. So the study focused on adolescents who vaped and reported respiratory issues, including shortness of breath, excessive coughing, chest pain, and fever. So the study highlighted that imaging and laboratory testing, as well as clinical history, are critical components in assessing vaping-associated lung injuries in youth. My next slide focuses on the subjects or the participants for this action research project. So the students that are enrolled in health classes at Huffman High School in grades 9 through 12 will be the selected sample. There will be 2 classes per semester that will receive regular health class instruction. There'll be 60 students in Class A and 62 students in Class B. So there will be a total of 122 possible participants in this study. With principal approval, the students will receive parent consent forms and student assent forms to take home for parental and student approval before participation. The consent and assent forms will adhere to school and district protocols regarding student privacy and confidentiality. This is an overview of my action plan. So this will be a 6-week action research project. The project will use 2 established health classes with enrolled students to test whether public service announcements about the health risks of vaping and the social pressures related to vaping are effective. If so, the project will also investigate whether these announcements can reduce discipline referrals related to vaping. Class A will have 60 students that will receive the PSA intervention. Class B will have 62 students, and they will serve as a comparison group, and they will only receive regular class instruction. Both classes will receive the same surveys. Class A will be the class that will receive the PSA. Class B will be the comparison class. So they will receive the PSAs before and after the 6-week intervention. The surveys will combine short, standardized quantitative items and a few targeted open-ended items. Also, the pre and post surveys will measure baseline knowledge of vaping risks, current attitudes towards vaping, as well as student perceptions of how harmful or socially acceptable vaping is. Vaping-related discipline referrals will also be compared by examining the number of referrals recorded for each class in fall of 2025 and evaluating changes after the PSA intervention. Baseline referral data will be collected from the beginning of the semester for both classes. After the 6-week PSA campaign is implemented in Class A, new referral data will be gathered again from school discipline records. The total number of vaping-related referrals during fall 2025 will then be compared within each class, pre and post, to determine whether the referrals decreased over time and between the two classes to identify whether Class A showed a greater reduction than Class B. The next slide is a timeline, a visual timeline that shows how my research will be conducted. On the far left side, it shows the tasks that must be carried out. In the middle shows the activities that will be done, and on the end is the timeline for the particular activities. So the first task will be the planning task of the action research, where the research question will be defined, literature will be reviewed, and administrative approval will be obtained, and that would take 2 to 3 weeks to complete. The next task is data collection preparation. So during that time, I will be developing and administering PSA materials, the pre and post surveys, and also collecting referral data. So that will be 1 to 2 weeks. The third task would be the actual implementation, where the PSA campaign will be launched at Huffman High School through poster PSAs, announcements, and social media. So that would be a 6-week implementation. The next task is the data collection, where I will administer post surveys and collect vaping-related disciplinary referral data. That'll take about 1 week. The next step is analysis, where the pre and post intervention data and referral data will be evaluated for changes, a 1-week timeline. And then the last task would be reflection and reporting, where the findings will be summarized, conclusions will be drawn, and results will be shared with stakeholders, and that would take 1 week. And the last slide is the references that I used during this particular part of the presentation. This ends the presentation for my action research. So at this time, if anyone has any questions about the research or any comments or any feedback, I am open to any comments, questions, or feedback that anyone may have at this time.
Well, Coach Slater, I think that is an excellent study. I think this is a well needed. Vaping is a problem not only at Huffman High School, but in many high schools across the United States. And I think this study will give us a better look of what we need to do to put in preventive measures to counteract what's going on throughout the school system and throughout the nation with the introduction of vapes. And vapes are so recent in the last 5 to 7 years. They become more recent than before, and the students use those as an alternative to say that they're not smoking, they're vaping, and they're doing the exact same thing. So I think, and it's having the same effect with the same active ingredients in it. So I think this study is much needed, and I welcome the study, and I would do, and the staff would do everything that we need to do to support your efforts in making it successful.
Thank you, Dr. Lyons. Were there any other comments or questions or any other feedback about the research?
I think it was a great presentation, and I agree with Dr. Lyons. It's very prominent in our school system. We get a lot of kids sent to the alternative school because of vaping. So this will be awesome as a starting point to try to see if these PSAs actually work. Because we put them out there. Hopefully, you'll give us some more insight.
Thank you. Any other comments or feedback? Okay, if not, I want to thank all of you for logging in to be a part of this presentation for my action research presentation. And again, I appreciate all of your support throughout the course. So thank you all so very much.
Thank you, Coach. You have a great evening.
You too.
Thank you. Good night.
Good night.